2 weeks after that massive earthquake struck Turkey and Syria, the region is still getting some aftershocks as the death toll nears 46,000.
A doctor from suburban Burridge traveled to Turkey on Sunday to help treat the injured. Dr. Zahir Salul joins us now from Turkey. Thanks for being with us.
Thank you for having me.
What have you seen just in the hours since you've arrived?
I haven't seen anything like this. We visited some of the hard-hit areas in southern Turkey, city of Nurdag, city of Kahramanmaraş, and block after block, you have buildings that are completely leveled, as if that you have like a giant foot that crushed all of these buildings, so nothing left of them. And you have also some standing buildings in between. In a small city called Nurdag, I was told that there were about 2,600 people who died. 600 of them are Syrian refugees who live in southern Turkey. Very painful stories. I mean, the numbers do not give justice to what happened in this area. This is the worst earthquake that hit this area in the last 200 years. Yeah. One of the painful stories, I was talking with one of the rescuer from Malaysia, and he told me that they pulled 52 dead persons from one of the block, only 5 alive from one family.
Yeah, and we were looking at, actually right now we're looking at some of the video that you shot as you arrived in the area, and just the devastation is massive. I'm wondering, how do you even begin to help some of the individuals there who are injured, who are dealing with this? How are you able to help them?
We have a team of 12 physicians who came from different regions in the U.S. We have surgeons, we have anesthesiologists, critical care specialists, psychiatrists, and we are providing training to Turkish and also Syrian doctors on mental health support, on orthopedic surgery, on dealing with trauma patients. We brought with us portable ultrasound. These are devices that you can connect to your iPad or iPhone, and it turns to be like a Doppler screen, so you can take care of the patients in the field without sending them for CT scanners or MRIs. And we delivered also a lot of medical supplies with us. So hopefully we can do what we can do, but the needs are massive.
And I would imagine the needs are really on 2 fronts. Initially, you've got physical injuries, but also, as you alluded to, the mental health injuries. We just reported on this aftershock in the last 24 hours that must have just brought all of that fear rushing back to people.
People are very traumatized, and yesterday we were in Turkey when the aftershock happened, and people went to the street panicking, I've never witnessed anything like this, and they were very fearful to go back to their homes, even though that there's only few injuries and few deaths, unfortunately, in the west of the area in Turkey, because they are afraid that the same thing that happened 2 weeks ago will happen again, and they won't be able to be pulled from under the rubble alive, especially children. One of the doctors told me that he's seeing traumatized children that they cannot speak, they cannot go to sleep, even they have urinary retention because of the trauma they have seen, and this is continuing. Many of the people are homeless right now, especially in Syria, 300,000 people, and there's only minimal supplies and aid that's going to northern Syria, where the area was hard hit. Yeah. The need will be massive for the foreseen future.
What would you like Americans here to do? How can they help? I know we've put up a number of sites that people can donate some dollars, but what else can they be doing right now?
Paying attention to this earthquake. This is the worst earthquake that hit this region for 200 years and probably the world in the last 100 years. The number of people who were traumatized or impacted, more than 23 million between Turkey and Syria. And the area will need to be rebuilt in some areas from scratch. So attention, donations. The people in the United States and Chicago were very generous with MedGlobal and other organizations. Continue to donate and keep the people of Syria and Turkey in your prayers.
Dr. Salul, most days you can find him at Advocate Christ Medical Center in Oak Lawn, but he also works with his group MedGlobal on missions just like this. Thank you for joining us live from Turkey. We appreciate it.
And also, by the way, we want to mention that we have a list of donation and aid sites on our website, WGNTV.com. Just scan the QR code you see right there on your screen.